Hi, welcome to episode 30 of the Milk Making Minutes. I'm your host, Lo Nigrash. This week, I'm going to spend about 10 minutes talking to you about thrush. By the end of this episode, you will understand what are symptoms of thrush, when it might not be thrush, what not to treat thrush with, what are good treatments for thrush, and other things you need to do while treating thrush to make sure it gets fully treated. So let's dive in. When I began breastfeeding, I was blindsided by how difficult it was. I may have thought I was prepared, but having known only a handful of people who had ever breastfed, and only seeing it up close from a couple of them, I had a huge learning curve. Since then, I've become a doula, a lactation consultant, and a childbirth educator. Many of my clients are surprised by their own self-doubt and anxiety over every baby feeding decision. And in the years that I've been connecting with people during pregnancy and breastfeeding, I've seen time and time again that those anxieties are reduced through hearing from others about their experiences without judgment or fear. Welcome to the Milk Making Minutes. I'm your host, Lo Nigrash. I invite you to sit back and listen in to reduce your breastfeeding anxiety through explorations of real-life breastfeeding. So, thrush is often undiagnosed or misdiagnosed because the symptoms are so related to so many other things. And so often providers are trying to pinpoint what exactly it could be. Thrush is essentially a yeast infection. It's an overgrowth of a fungus that normally lives in our bodies, and it prefers wet, moist places. We're often familiar with vaginal yeast infections, so it's a breast yeast infection. And often we get breast yeast infections or thrush during nursing because our breasts are already warm, the temperature increases during breastfeeding, and then there's a lot of wetness during breastfeeding. Thrush is diagnosed in the parent by having shiny nipples. The areola and skin has a stabbing pain. There might be flaky nipples or mammary pain, but many of these symptoms are also in play when you have mastitis or when you have a plugged duct or when you have Raynaud's syndrome, or it could possibly be vasospasms or some sort of bacterial infection. And of course, having a shallow latch or nipple damage in general can lead to these symptoms. And so these need to be ruled out before we start giving medication for thrush. But in the baby, if we see that not only is there shooting pain in the nipple and the skin is flaky and often there are red patches around the nipple and the areola, and we also see that there are white patches in the baby's gums, cheeks, palate, tonsils, and or the tongue. And if it's wiped off, it may look red or it may bleed. And there's also a diaper rash, or it might simply just have raised red dots. Then definitely having the symptoms in the baby and in the parent together, that's a real good indication that thrush is the diagnosis.
Do you love to read about pregnancy, childbirth, and breastfeeding? Are you looking for books to help you become a more confident parent? Or perhaps books to help you understand what went wrong with your breastfeeding journey or to do better next time with breastfeeding? Or do your kids have questions about breastfeeding or pregnancy, but you don't really know how to answer them? Would you prefer to have a curated list on these topics? Go to the link in the show notes to my new affiliated bookshop. Every purchase you make benefits the Milk Making Minutes. But better than that, these books are vetted. I've read them all, and I feel very confident recommending them to you. I'll be adding to them continuously. So go to that link when you want to purchase a book. It will help the show, and you can feel confident it will be a purchase you will enjoy.
So, what to do if you do have thrush? It is really important that both mom and baby be treated. Often we'll find that only the part of the dyad that is experiencing symptoms is treated, but that allows for both of the dyad to continue passing thrush back and forth to each other. So if it is determined that yes, the nipple pain is as a result of thrush, then baby needs to be treated as well. There are a couple of treatments which have been used historically, which I am going to say are no longer recommended. And I am getting this information from Nancy Moorbacher's Breastfeeding Answers, a guide for helping families. It's the second edition. So the first treatment that I would say you'll find often on online support groups is gentian violet. It's a dye. It's often recommended in both the parent and the baby, but it is now considered by the World Health Organization to be a carcinogenic, so it's no longer recommended. The second treatment that is really commonly prescribed for both the parent and the baby in the United States is nystatin. But in some studies, we are seeing that nystatin is way less effective than some other treatments. So one U.S. study found nystatin effective in only 32% of cases. So I would say if your provider is not up to date in breastfeeding medicine and they try to prescribe nystatin, then ask for another treatment. And I will go over what those could be. Now, if you are someone who likes to go for the least aggressive method possible before you even go to the doctor, you could try a more natural treatment using 1 teaspoon of vinegar with 1 cup of water that you apply after each nursing session to the nipple and allow it to air dry. But this is really only if you're seeing just symptoms in mom and not in baby, and it's really at the very beginning. And in mild cases of thrush, once the treatment starts, there may be some relief in 1 to 2 days. In more severe cases, it may take 3 to 5 days or longer. But, if you've been experiencing symptoms for a long time and it has taken a while for you to even discover what it is, then you might consider a more aggressive treatment. But the treatment that I will recommend that you discuss with your provider when you're looking for a prescription treatment for thrush is fluconazole. And you can get this for both the baby and for the parent. It's an oral suspension dropper for the baby, and it's a topical treatment for the parent. And typically you continue it for a week after the pain is gone for the parent and for about 2 weeks for the baby. So that has been shown to be one of the most effective treatments. There are other medications that are used. You can definitely ask your provider about what they are. In addition to getting the medication for the treatment of thrush, some things that some people don't think about is that you really need to make sure that anybody who comes in contact with something that the baby uses in their mouth also consider getting treatment. For instance, if there's an older sibling around who might put anything that the baby puts in their mouth, you might check for thrush. So if there's a sibling who likes to put the baby's pacifier in their mouth, or who might, put the baby's bottle in their mouth, they may have thrush. So you may need to be treating more than just the dyad, the breastfeeding dyad. If you're nursing more than one child, so if you're tandem nursing, you probably need to treat the other children as well. Make sure you're washing the baby's hands. If the baby likes to suck on their hands, on their thumb, they need to have their hands washed regularly. Any pacifiers, bottle nipples, teethers, boil them once a day for about 20 minutes to kill the yeast. And then after the treatment is completed, you may consider discarding them and buying new ones, so that you're not worrying about whether or not the yeast has stayed on those items and is going to be passed back to you after the treatment is complete. If you use breast pumps, boil any parts that come in contact with milk for 20 minutes. And nursing pads, make sure you're using disposable ones, at least for the duration of the treatment, and that you're discarding them frequently after each feed. And then washing all toys that the baby puts in their mouth in hot soapy water and rinsing well. And then one final thought about having thrush is that some parents are worried about using expressed breast milk from the time that they've had thrush. The Academy of Breastfeeding Medicine's clinical protocol number 8 on the storage and handling of human milk wrote, quote, if a mother has breast or nipple pain from a bacterial or yeast infection, there is no evidence that her stored expressed milk needs to be discarded. So it is totally fine to use the milk that you express during that time, either immediately or freezing it and using later. So that's everything you might need to know about yeast. I hope that you pass this episode along to someone who you think could benefit from hearing it. Like I said, most of this information I have gotten from Nancy Moorbacher's Breastfeeding Answers, a guide for helping families. And if you would like to hear a story of somebody who dealt with thrush during their breastfeeding experience, listen to episode 29 with Emily.